evolving models of care and how evidence systems and skills must adopt to meet the needs of modern medicine. It is now my privilege to acknowledge our distinguished chairs for this session. I'm going to welcome Professor Mohammad Akbar Chaudhry. He's a senior academic physician, long-standing contributions to internal medicine, Dean Medical Sciences, Superior University, previously Principal and Professor of Medicine at Azra Nahid Medical College. Sir, Professor Javed Akram, I'm going to request you to join me on stage. Chairman, Board of Directors, PSIM, and formerly served as the Provincial Health Minister. Can I please request the audience to be seated? I'm going to welcome Professor Amir Shaukat. He's Pro-Vice Chancellor, Faisalabad Medical University, Vice President, PSIM, Vice President, Punjab, PSIM. Thank you, sir. I'm also going to welcome Professor Muhammad Tariq. He's a respected physician and educator known for his commitment to academic excellence. He's Professor and Interim Associate Dean Education at Aga Khan University Hospital, Karachi. Thank you, sir, for coming. I'm also going to welcome and call upon stage Dr. Moeed Ahmed. He's Consultant Emergency Medicine and has joined us from Dubai. He works at the American Hospital, Dubai. Thank you for guiding this important session. Thank you. We begin this session by looking at the physicians of tomorrow, the skills they will need, the systems they will work in, and the values that must underpin their practice. It is a great honor for me to welcome Professor Mumtaz Patel, who will speak on Physicians for the Future, UK and Global Perspectives. She's President, Royal College of Physicians, London. We are very thankful for her to be here. She's a wealth of international experience in physician training and leadership. Ma'am, please join me here on the stage for your talk. Thank you. Can I please request the audience in the back to settle down and maintain silence? Thank you, please. Ma'am, please.
Okay, assalamu alaikum. Good morning. Nice to see you all. So I'm going to talk about physicians for the future. I know I'm being timed, so I'll try and keep to time, and I know we're already running late, so bear with me. So thank you for the kind introduction, Wafa. And what firstly to say is that I've got nothing to declare. What I'm hoping to cover in this session is around the concept around physicians for the future, both in the UK and global perspectives, acknowledge some of the key characteristics around what a physician for the future should encompass, appreciate the change of the changing face of medical education, as there's been lots of changes over recent decades, and then give you a bit of an overview around medical education and training for physicians of the future. I'm President of the Royal College of Physicians, and what I'll talk through just at the end is some of our work around addressing health inequalities. I know Professor Akram was talking yesterday about the levelling up and addressing some of the health inequalities here in Pakistan. So again, in the UK, there's a big push around prevention and addressing wider health inequalities, and of course, supporting our next generation of physicians. So firstly, to start off with a quote. This is a quote from the 1950s, but still very relevant today, saying around the importance of a doctor being an educator, and also that importance on prevention and how we avoid our patients and make sure that they remain healthy and prevent them from getting into hospital in the first place. So that importance of both medical education, but also the importance of prevention as well. So what are the key concepts and definitions around the physicians for the future? So it's a vision for a more adapted. We talked yesterday in the early session around patient-centeredness and technology being integrated into the medical profession, emphasizing that importance of lifelong learning, interdisciplinary collaboration and innovation, rather than just a single organization emphasis as well. And that future doctor would leverage some of these tools around AI, around personalized care medicine, focus on prevention, as I've talked about, and that broader focus on emphasis on holistic medicine and patient care, which I think is extremely important. So what's the physician of the future? What should they look like? So, you know, kind of now with the diversity in education, the diversity in the medical workforce, we talk about over 50% of women in the healthcare workforce, or up to 70% are women. So a young female of an ambiguous race, again, supporting that diversity, embracing that diversity within the medical profession, and that emphasis on the smartphone. Even my children will just look at the phone most of the time rather than at the screen, or even with teaching as well. So that impact of technology as well on medicine. And then that map over the shoulder, represents that globalization of medicine, and then the clouds possibly represent uncertainty. So this was from the Canadian Medical Education Journal a few years back, emphasizing some of these points. So when you think about the key characteristics of the future physician, what would they look like? So of course, the importance of technology and being proficient in technology is really important, and integrating that advanced technology. Even at the college, we've been producing papers around AI and how we digitally enable our physicians for the future as well. I'm probably quite digitally naive, so how do you embrace that technology within our medical education, both in undergraduates and in postgraduate medical education? That holistic and community orientation is important. One of our shifts in the National Health Service is talking about hospital to community and shifting the practice into community care and closer to patients as well. Precision focus, that importance of precision medicine frameworks, and always collaboration and being flexible and making sure that you're working across the disciplines in a multidisciplinary, multi-professional way. So shifting that focus of practice. So I guess over time what we're looking at is fewer diagnostic experts and more enhanced generalism. So again, at the college we push a lot around generalist medicine. So that's much more catering for our patients with multimorbidity, lots of different comorbid factors, rather than single organ physicians. And yes, specialized technical skills, that increase in advanced technology, we need to embrace that. And again, that highly specialized skills development. When you think about essential skills in training, of course, communication is always key. So that strong emphasis on communication is crucial for conveying that messages to our patients, improving that patient rapport, but also their compliance and understanding of their health and needs as well. Being adaptable is really important, and lifelong learning, which I guess as physicians is something that we're very much used to. And then that emphasis, the last point around public health and risk communication. So public health should be everyone's problem. We've talked about obesity and other social determinants of health. Those things are so important to embrace, and it's not just the role of the public health physician, it's the role of all physicians, I feel, which is really important to ensure that prevention is on the agenda for all. Global implications. So climate health is a reality, as we know, and that image of that kind of global challenges and impact of the health, global health on climate health on the practice of both medicine, but also for patient populations, diversity across the world. And also the medical workforce is changing. So the medical workforce, both in the UK, internationally, is forever changing. And I'll talk through that in the next slide as well. So in the UK, now for the first time in figures from 24 and 25, doctors from an ethnic minority background make up the majority. And as you can see on the right-hand side, the picture shows, the graph shows the increase in doctors from South Asia in particular, from Middle East, North Africa, and from the rest of the world as well. And 2/3 of our doctors joining the NHS workforce over the last few years have been our international medical graduates. They've bolstered our UK healthcare system for decades. Locally employed doctors, so those doctors who are in non-traditional training pathways, is increasing, and some thoughts around the drivers for that, around flexibility, about people wanting local training pathways rather than moving to lots of different places. And also women in the workforce make around 50%, half of the workforce. However, there's still a disparity in senior leadership positions. So we talked about that yesterday in our Women in Leadership workshop yesterday morning, which was very well attended, and we talked about some of the barriers and enablers. Even for our Royal College of Physicians in London, we're over 500 years old, and it took over 500 years to have a woman of an ethnic minority to become president. So there's still change that needs to happen, not just in the UK, but globally, so a lot of work around that. And in the same light, equity, inclusion is really important for all doctors and should be a priority for the medical workforce, both in the UK, but also globally. Talking through the good medical practice, so that's our regulator, the GMC in the UK, comes up with different updates, and our good medical practice guidance was updated about 18 months ago. And the key areas to consider are around respectful, fair, compassionate workplaces. We talked about compassion and empathy yesterday, really important around patient-centered care. And again, those inclusive, fair working environments, which is really important. And then the updated standards on the right-hand side that you can see talk about knowledge, skills development, creating good partners, partnerships, communications, and colleagues and culture, and safety, the importance of safety and culture that we again talked about yesterday in some of the sessions as well, and instilling trust and professional behavior, professionalism skills. So what's changed over the last few decades? So lots and lots of changes in medical education. We've of course moved from that didactic learning to problem-based learning, case-based learning, that emphasis on integration and competency-based curricula. We've changed the methods of assessment. I used to have big essays to write in medical school. We've moved from that to more competency-based OSCEs, workplace-based assessment, and now entrustment professional activities. And that focus on professionalism, it's less about knowledge and skills we can get from our phone, but it's how do you instill professional behavior and that wider generic professional capabilities. And that impact of the educational environment, which is absolutely key on both learning and assessments as well. And more recently, particularly around post-COVID, that importance of student and trainee well-being is really important, because workforce well-being, unless our staff are well, our students are well, they won't learn and perform in the environment. So really important to have that emphasis as well. For the college, we produced this professionalism report back in 2018, and that is still quite relevant now, because I guess there's an increasing gap in what we teach to what we actually need to do on the ground as well. So the doctor's role over the years, my grandfather was a medical officer in India, and his role as a doctor, patient healer, to moving to a manager, a teacher, a researcher, all these things that you have to do now as a physician is very much changed. So as the role of the doctor changed, we need to think about how we teach our medical students, how we teach our resident doctors to progress in that kind of realm as well, because things change. And again, we need to adapt how we teach and learn and also assess as well. So the goals around modern medical education are shown here. So standardizing learning outcomes is very important, making sure that we're customizing the learning process and including all the different factors. So whether it's research, technology, policy, education, leadership, instilling leadership skills early is really important. And we emphasized those points yesterday in some of the sessions as well. And that constant integration around knowledge, skills, values, behaviors, and continuous innovation as well. And medical schools and postgraduate systems working alongside together. So there's a seamless transition between undergraduate and postgraduate medicine, and also making sure our faculty development processes and our supervisors and educators are supported in that process as well to deliver in the needs of what is needed for today's modern medical education. So the GMC, our regulator in the UK, talks about generic professional capabilities. And again, this demonstrates the wider role and breadth of a doctor as well. So we've got the knowledge, skills, and behavior in the center. And then we look at the circle with all the interdependent skills. So whether that's research and scholarship, education, training, safety, quality improvement, leadership, team working, all those skills are equally important in addition to the central core themes as well. And what we're trying to do over the years is that shift in emphasis in medical education. So rather than just the informative learning that produces expertise, what we want is that formative learning, continuous development that produces professionals. And then over time, we want that transformative learning that develops that enlightened change. So that's the shift that we're moving towards. Thinking through COVID, I guess lots of negative impact on education and training during the COVID times. Of course, we had to change and adapt the way we teach, the way we learn, but also how we assess as well, and significant uncertainty around progression at that time, and also around academic trainees, and we shifted in the way we taught to hybrid learning, which is obviously still there to continue, and had that significant negative impact on trainee-trainer well-being, mental health, anxiety, burnout, and moral injury, which are still really real and ongoing issues, certainly in the UK, but I'm sure internationally as well. The top 5 trends in medical education are shown here and wider as well. So we've been expanding medical schools, but we need to expand the number of seats in postgraduate training from foundation core to specialty training, and that's something that we've been pushing for. Of course, hybrid learning is here to stay, and that needs to continue. The role of AI and digital in medical education, and that focus on mental health that I've talked about, and that importance of diversity, inclusion, and equity, which is really important, and fairness principles in education as well. There have been new targets on race equality in the UK, and that talks about fair training pathways, around having fair recruitment, fair assessment methods, fair progression, and providing that supportive, inclusive education and learning environment. We know if we have that, the importance of educational environment is key, and if you get that right, then learners learn better, progress better, and in a fairer way as well, because these attainment gaps are still there, and we need to try and keep on working on that to narrow those over time. And the greatest barrier in reducing those attainment gaps is the lack of evidence. So over the last 10 years, some of my focus has been around narrowing the gap of differential attainment. And what we found, the core themes that work from the interventions, is around mentoring, peer support, early identification of learning needs and support, and that importance of good quality feedback. Exam preparation is important, and then training the trainers to better support individual trainees. And moving away from that deficit model, all of you here, as I've said yesterday as well, are more than capable. And we know that the educational environment is absolutely key, and we need to think through how we better support our educators to support our learners. So again, that changing shift. And again, the program around reducing the attainment gap has been a nationally led program around cross-specialty research across organizations, earlier identification, earlier support, both from a trainee perspective, but also from educator, learners perspective as well. So improving both trainee and trainer interventions are equally important, and moving away, as I say, from that deficit model to support learners. Thinking through addressing health inequalities, so lots of learning from the COVID experience, understanding the social determinants of health, and awareness of system leaderships as well from a leadership perspective. In the UK, we talk about the 3 shifts, so moving away from healthcare, from hospital to community, analog to digital, sickness to prevention. So this is within our 10-year plan for the NHS, and that's things that we've been influencing and working through as colleges in the UK. And from a health inequalities perspective, we've been pushing on a mission delivery board to bring together all the departments to influence a cross-government strategy to achieve health equity, which is absolutely key. And Professor Akram talked about health equity here in Pakistan as well, which is so important. Everybody has equal access to healthcare, but also to the treatments and their outcomes as well. So the program of health inequalities within the RCP has been quite active for the last 5 years or so, and this is bringing together lots of different organizations to work with the same aim of improving and reducing the health inequities. So whether it's the tobacco and vapes bill, the restriction on junk food advertising that we were talking about, obesity just now, minimum unit alcohol pricing, lots of different things to address some of those social determinants. The other big theme of the college that we've been working on is supporting our next generation of physicians. So we're empowering our next generation to produce the best possible healthcare, and they've been working really hard to drive the change in the college over the last 18 months. We've produced different position statements, campaigns, discussing different training pathways, and influencing the medical training review, which is currently ongoing in the UK. And last year at our annual general meeting, we first time in 500 years changed the constitution so that our resident doctors, our collegiate members, can vote in our elections, which are currently active. So lots of hopefully positive change. and influencing the national conversation as well. So again, I get our resident doctors to meet our key leaders in the UK to try and support their voices and make sure their voices are heard in leading the campaign to improve their educational environment and their training environment, and hopefully help with their progression. So the latter few slides are just around changing trends in teaching and learning. How we used to teach and learn is very different to how we teach now. My children learn in very different ways, whether it's podcasts, YouTube videos, very different. And again, the same in training, whether it's artificial intelligence, VR, and all these different tools that we need to embrace. How we assess has also changed as well. So rather than just the didactic ways of assessment of essays and things, it's much more integrated into more OSCE-based learning, workplace-based assessments, and now entrustment professional activities. And that's your Miller's Pyramid, which is just continuing to that kind of trusted level now as well. And the same within our curriculum. Now we have capabilities in practice, which look at whether you can run a ward round, whether you can run a clinic independently, and how level of independence changes from year 1 to year 3 in internal medicine training, and thereafter into specialty training as well. So that greater focus for physicians in the future will be on personalized learning, improving their educational environment, that focus on student trainee well-being, but also emphasizing and maximizing the digital solution, interprofessional learning. Flexibility is absolutely key, and focusing on self-care and how you support others. And I can't not have my slides to include compassionate leadership, which I think is absolutely key in how we are with our patients, but also with our learners and with our teams around to improve things on the ground. So that degree of empathy, connection, how we listen, how we support. And we talked yesterday in the different workshops around the different components of compassionate leadership. So whether it's attending, active listening, emphasizing, understanding, and helping in the true sense in that kind of active listening phase as well. And lastly, just to say around self-compassion is as important as supporting others. As I always say about my mum saying that if you can't look after yourself, you have to look after yourself so that you can support others around you, which is so, so important. So that importance of self-care is equally important to support others. And finally, will AI replace physicians? I don't think so, because that doctor-patient relationship is very based on empathy and trust, and that AI will never replace. Of course, it may augment it, and we must embrace it, because it will help, kind of practice as a physician. But certainly, so many tasks are out there, which is so much broader than what AI can produce. So hopefully I've covered my intended learning objectives, which I set out just about in time, and I'm very open to questions later. Thank you so much for your listening.
Thank you very much, ma'am, for finishing well in time.